Are your dogs a barking? You should listen to your feet. We have Dr. Maasi Smith, a foot surgeon and director of podiatry at the Urban Health Initiatives.
How you doing?
Dr. Go, it's good to see you.
Again. Absolutely. Good to see you as well. Again.
Listen to your feet.
Absolutely.
Give me some examples, like people have different maladies with their feet.
Absolutely.
Like when your feet get swollen, what does that mean? Is it just bad circulation?
Well, that's one of the things. It could be lymphedema, it could be bad circulation, it could be other issues, it could be diet, increase in sodium uptake. So there are a lot of things that can go on, but one of the things we're trying to push is that people are aware of these issues that can occur, and if you do see this in your feet, to really get to see a doctor as soon as possible.
You can't miss that. What do you do for something like that?
You'd be surprised. I mean, people will sit home for months, if not years, to actually, they won't go see a doctor. And that's why we're here to discuss that.
What do you mean they won't go see a doctor?
People do not go see doctors. I see a lot of people at the end stages of foot problems.
What could you do about that? The swollenness?
Well, that you could do. Well, it could be a diet control, in which the internal medicine doctor would deal with that. We can do things like TED stockings or compression hoses.
But when you see something like that, what comes to your mind?
Like
What's wrong with the rest of their body?
You know, and that's what has to be discussed. That's why blood tests are taken, and that's why it's an overall evaluation. It could be any number of things. It could be normal for that person. It could be genetic.
Now, I notice sometimes when Mike's wearing his sandals, I can see spots on his toes.
Absolutely.
What's that?
Well, it all depends on those spots. I mean, spots could be simple bud bites. they could be a lot of particular things. Could be diabetes.
Ooh, look at that.
So that's on the bottom of someone's foot?
That's actually at the top.
Is that the top?
That's actually
the hair
top.
on the top.
Yeah, petechial hemorrhaging. So again, it's important for people to come in and get an overall evaluation. That's what we do at Urban Health Initiatives, to give people overall evaluations and figure out exactly what these
But if you
issues are
had to
stemming
make
from.
a snap decision, you see that doesn't look like bug bites to me.
No, but you can't rule it out as well. You can't rule it out as well. It could be diabetes, or it could be a complication for diabetes.
So you would suggest a blood test immediately?
I would suggest, yes. I would suggest several blood tests to see what's going on.
You ever see, well, I know you have because you're a podiatrist, clubbed toes? Some people say clubbed feet, but clubbed toes.
Clubbed toes, yes. This is
oh my goodness.
Well, we're just trying to push awareness, and clubbed toes. It's amazing because that's on the feet, but nobody's going to think of systemic ailments. I mean, this could be caused to digestive disease, Crohn's disease, celiac disease, cystic fibrosis,
you ever see that, Doc?
Graves' disease.
I've never seen
that.
Very
rare.
That's
very rare. But when you see something like that, that's why good communication between us and the primary care is very important.
Yeah, I've heard people say this, Karen. You hear this? My feet are burning.
Yeah.
It feels like my feet are on fire. What is that about? What's wrong with the rest of their body?
Well, sometimes that could be because of diabetes. We have a lot of undiagnosed patients that come into our facility who are unrecorded diabetics. And that diabetes is due to something called peripheral neuropathy. And a lot of people with diabetes understand that, and they've heard that word before, but sometimes don't understand what it is.
What is peripheral neuropathy?
Peripheral neuropathy is when the nerves are adversely affected by the excess sugar in your body.
Oh.
And so therefore you start losing feeling and things of that nature, and that's why we have these lovely shoes here to show the type of shoes we give people who have peripheral neuropathy, because these help support and decrease pressure areas.
Which shoe helps with that malady?
These two right here. The
pink ones here? And then these things?
The big, yeah.
What? Why? Look at them. They're not very attractive.
They're not very attractive, but they serve a purpose, and that purpose is to help with the swelling, which we discussed earlier, to decrease swelling. So if somebody has excess swelling, but they are diabetic, a type of shoe like this will really support them because they're allowed to swell. Somebody with diabetes who may not swell too much will be able to put these shoes in there. And they're extra depth molded shoes. They may look normal, but they're made they're made in a particular way to be able to allow support. So we have stylish shoes and we have not so stylish shoes, but we try to do the best we can.
Well, people who are hurting don't care what it looks like, I would imagine. Real quickly, have you ever heard of something called red, white, and blue toes?
Yes.
What in the heck is that?
It's called raynauds phenomenon.
Do our Olympic gymnasts have them? No.
Well, anybody could have it. The etiology, nobody really knows where it comes from. It's a spastic deformity. Can happen in the hands and can happen in the feet, where the feet change color, usually due to extreme weather or cold.
Oh,
it's like the feet become blanched, they become red, and they become blue.
Looking at that. So what do you do for something like that?
You support it. You support it. Depend on the severity of the symptoms. If it's extreme cold, you get them to warm.
But what is causing that swelling? Is that blood down in there?
Yeah, the blood vessels. Yes, it's a spasm. They're actually spasming.
But bottom line, if you feel something's wrong with your feet, come in, because you may be able to find out you have diabetes and you didn't know it. Burning could be, it's not just because you have to walk far and you're hard at work and your job's, and you're on your feet all the time. You could have some bigger, larger health condition.
Yeah, I mean, just yesterday I had to schedule a patient for an amputation.
What?
Yeah, well,
now people are going to rush in.
Well, no, honestly, because people don't come in when they first see a problem. And I've had this, and I've seen it increasingly, especially being in South Philadelphia, that people come in at the end stages of something. Right. And what I'm trying to do is just educate the public. And if you see the spots, if you see the edema, come get an evaluation, because I have people come in and it's like amazing.
So if this person had come in earlier, maybe the amputation wouldn't have happened.
Yeah, the sore that he had may have been less significant, and maybe there may not have been any reactive bone at the time.
Wow. Where'd you get your degree?
Temple University, School of Podiatric Medicine.
Good to have you here.
Yes, sir.
Doc, thanks.
Thank you very much.
Thank you, Dr. Smith.
Okay, I could not be a podiatrist.